YouTube. Welcome to Dr. Vibes, a learning point. Okay, in this video we'll study the interpretation of iron studies. So usually there are 4 cases that you have to know. Iron deficiency anemia, anemia of chronic disease, hemochromatosis, that is iron overload in the body, and if you are using OCP or you are pregnant. Then what happens to the iron profile, that is serum iron, ferritin, transferrin and TI and percentage transferrin saturation. Okay. Now I will suggest you that remember one and the other are related. So we will remember iron deficiency anemia because that is the easiest. So iron deficiency, as the name says, that there is deficiency of iron in the body. अगर body में iron कम है तो सेरा में भी कम होगा, इसीलिए decrease. Now what is transferrin, what is ferritin? Transferrin is the one that transfers iron and ferritin is the one that stores iron. तो अगर body में iron कम है तो जो storage है iron का वो भी तो कम होगा. So ferritin will also be low. Now there is one trick that transferrin and ferritin is just opposite to each other. If ferritin is high, transferrin will be low. If ferritin is low, then transferrin will be high and vice versa. Okay, so these three clear. Iron deficiency में iron कम होगा, iron का storage कम होगा, तो ferritin कम है, serum iron कम है. Ferritin और transferrin उल्टा होता है, इसीलिए अगर ferritin कम है तो transferrin ज़्यादा होगा. Now what is percentage transferrin saturation? Percentage transferrin saturation is serum iron by TIBC. तो अगर numerator कम है और अगर denominator ज़्यादा है, then what will happen to percentage transferrin saturation? Obviously it will decrease a lot. Numerator अगर कम है, denominator ज़्यादा है, then overall it will decrease. So this is iron deficiency anemia. Now, just the opposite of iron deficiency anemia is hemochromatosis, that is iron overload in the body. Exactly opposite. If this is decreasing, this will increase. Increase, decrease, decrease, increase, decrease, increase. Just you will remember that iron deficiency का एकदम उल्टा है hemochromatosis. Now what happens in thalassemia? You give iron, isn't it? Because thalassemia में iron का problem है, iron blood transfusion कराना पड़ता है. So in thalassemia also similar picture will be shown as in case of hemochromatosis because it is a condition of iron overload in the body after repeated blood transfusion. Now, what you have to remember is now chronic disease which is also similar. Chronic disease मतलब बहुत दिन से कोई problem है ना? तो क्या होगा? Iron obviously कम होगा ना body में. There will be less iron in the body because बहुत दिन से anemia है. But the body has acclimatized, body is adapted to the situation. तो storage में फर्क नहीं पड़ता है because body is adopted. So ferritin is high. Even if iron, serum iron is low, ferritin is high because body is adopted here because it is a chronic disease. Now I told you the transferrin is just the opposite of ferritin. So अगर ferritin high है तो transferrin क्या होगा? Low होगा. Easy. Now what happens to the transferrin saturation का percentage? As I told you, this is the ratio of the serum iron and TIBC. Here iron is decreasing and TIBC is decreasing. तो दोनों अगर decrease करता है तो ये तो normal हो जाएगा ना? Or it will decrease depending on which is higher or which is lower. Okay. Now in pregnancy and OCPs, you just have to remember 2 things. That is transferrin or TIBC and percentage transferrin saturation. और प्रेगनेंसी में क्या होता है? फीटस को देना पड़ता है ना आयरन, तो ट्रांसफर करना पड़ता है, इसलिए transferrin will increase. Okay, transferrin amount of iron will increase. And in pregnancy and OCPs, the percentage transferrin saturation will decrease. This is just have to remember. So you are remembering only 3 things from here. Iron deficiency, वो भी आपको concept से समझ में आ जाएगा कि iron deficient है body में तो क्या होगा. In chronic disease, there is similar picture. Like there is iron deficiency, but body is adopted. इसलिए ferritin यहाँ पे increase होता है. This is just the opposite of iron deficiency anemia, and in pregnancy you have to remember the percentage transferrin saturation will decrease. That's it for the video. Hope you find it useful. If so, please like, share and subscribe. And if you can, please contribute to the channel so that I can make better videos.